Good day, fellow learners. This is your mentor, your fact check buddy, Gapuz, joining you for another teaching and learning session in this set of concepts specifically designed for our NGN pointers. And this is already set number 30. Now, let's proceed and let's buckle up because this is a ride. Okay, why? Well, you're going to find out in a little while. So let's begin. Before we get to start, I'd like to provide you with an advisory that our programs are manned by me, your mentor, plus our pool of very competent US licensed mentors like Mentor Che, who is US licensed in New York, Mentor Francis, who is US licensed also in New York, Mentor Missy, licensed in New York, Mentor Shan's US licensed in New York and in Vermont, Mentor Marisol, who is licensed in New York and California, Mentor McLean, who is licensed in New York, and Mentor Nicole, who is licensed in Ontario, Canada, and that licensure is also under NCLEX RN. And of course, yours truly, your fact check buddy Ray Gapuz, who is US licensed in Illinois and Georgia. So if you don't see us in your class, it's not a Ray Gapuz system class. So I'd like to make that clear. You have to see all of us in your class for you to be able to say that it's a Ray Gapuz system class. Okay, before we get to start, I'd like to invite you to join us in our next bootcamp on January 8th to 2024 at the Mount Crest Hotel, Gapuz, Baguio. So this is a very brief, fast-paced, high-yielding 10-day program that would prepare you to ace your NGN test on your first try. So don't forget the date. It's going to be January 8th to 20. Reserve now because seats are moving on so fast. So let's begin on the first question that we have to consider, and that's going to be, what do we need to study? First and foremost, when you're studying for NGN or next generation NCLEX RN, you have to get an expert's opinion. The expert who should guide you should be a person who has been through all the phases of the licensure exam, not just anyone who knows how to deliver lectures. They have to primarily be able to teach you how you will prepare for the test. Okay, so our first NCLEX alert is actually about Kava. Okay, so Kava, just like the Filipino word kaba, meaning you're nervous. So Kava, okay, is actually an anti-anxiety agent. Okay, now what is the implication of taking this herbal remedy? First and foremost, you have to know the fact that your kava grows in the Pacific areas like Hawaii or the Samoas. Okay, it is called Piper methysticum. So in essence, if your patient is coming from Hawaii or the American Samoa, pay particular attention to the fact that if they're coming in for anxiety disorders, they could potentially have taken kava. And what's the implication? You never combine kava with our minor tranquilizers or benzodiazepines like your alprazolam or diazepam. Why? When your kava and alprazolam are taken together, they could potentially depress the respiratory system because kava is a sedative. So it's primarily indicated for the short-term treatment of anxiety disorders. Now, what laboratory data do we need to check if the patient's taking kava? We need to check the liver function test, the AST and the ALT. Why? Kava is hepatotoxic. Therefore, you have to assess the patient for signs and symptoms of hepatotoxicity like persistent anorexia, nausea and vomiting, and the all-important yellowing of the sclera or the skin that's your jaundice. If you get to see any of this in your client, then you better clarify if the client has taken kava. Okay? So for a patient taking kava, never ever give this with your minor tranquilizers or benzodiazepines. For all you know, kava may worsen respiratory depression. Therefore, if you encounter a question that says, if the patient who is coming from Hawaii comes in due to anxiety attack, which question should the nurse ask the client? Ask the client, are you taking Kava? And if the patient is taking Kava, which doctor's order should the nurse need to clarify if the doctor orders alprazolam or diazepam? Because a combination of alprazolam and Kava or alprazolam, or diazepam and Kava may potentially lead to respiratory depression. Remember, respiratory system is the primary target system of the adverse effect of Kava. Okay, now, after that initial concept, let's get inspired. We have here a lady from Bicol, okay? That's the southern part of the Philippines, Madam Odette Rihuzo Gonzalez, who has been my student when she took her local licensure up to CGFNS when she took her licensure exam for teachers. She would always come here at the Ray Gapuz building from Ago Medical Educational Foundation in Albay, who passed the New York Board of Nursing Next Generation NCLEX last November 25, 2023. That's just a couple of days back. So let's listen from what she has to share with us in terms of strategies that she did so that it propelled her to pass the test. So for those who are asking about my secret why I passed the Next Gen NCLEX, it's time to say thank you to Sir Ray A. Gapuz and to the wonderful and amazing RAGRS team. I took my NCLEX exam a couple of days ago and my questions stopped at 125 items. Received good pop-up and pass. I attended the online comprehensive review, and our online review is just 5 hours a day, okay? And attended the face-to-face quick fix, dedicated myself to it, and I'm working full-time. That's the good thing about our program. It's very flexible because you can always watch replay videos unlimited. And if you opt to join us face-to-face, there's no additional fee, okay? Focus on the rationale. I watch Sir Ray's Pecha Kucha videos that's contained on my YouTube channel as well as in our quick fix course shells in the morning and answered TOP. That's also our Q bank. It's called TOP, and read rationales in the evening. Self-care is a must. I was mostly sleepless. So if you feel tired and sleepy, take naps and sleep well to help you focus and improve your concentration. 3-day quick fix. I attended the face-to-face quick fix. It was very helpful because Sir Ray tackled all important concepts that could come out on the exam. Grabe. Say, wow. Okay, Sir Ray, nakahelp sa akin yung mga test-taking strategies. Well, she was simply saying that the test-taking strategies I taught helped her na mention during the day ng 2-day quick fix plus the pharmacology book. Okay, your NCLEX 311 nursing reminder sheets is also recommendable. Take your time. NCLEX NGN also tests your reading skills. The latter was lengthier to read, so better ready yourself on this kind of question. Ooh, that was tough. Okay, I had 2 breaks because it is difficult for me to read all of the questions. And she said that in Tagalog, kasi di ko kinakaya ang mga tanong. Pray and believe in yourself. I always believe it's better to start with a prayer before studying. This is the most motivational tip of all. To God be all the glory. Again, thank you, Ray A. Gapuz Review System. I am forever grateful. I am forever a Gapuz baby. That's Miss Odette Rihuso Gonzalez from Bicol. Congratulations, Madam. Okay, our next NCLEX RN alert is actually the herbal remedy, Ginkgo Biloba. Now, Ginkgo Biloba is a blood thinner. And you find this plant, it grows in East Asia. So if you have an Asian client who comes to you complaining of bleeding, you may want to ask if the patient's taking Ginkgo Biloba. That's the implication. So what are the uses of Ginkgo Biloba? It's used to treat anxiety, glaucoma, take note, dementia, specifically Alzheimer's disease, and of course, it increases sexual functioning. Now, please pay particular attention to the fact that your Ginkgo Biloba is used as a treatment for Alzheimer's. It's not a cure. In essence, it will just improve on the symptoms. So it will potentially decrease the symptoms, but it will not bring the person to a normal state of health. Now, If your patient's taking Ginkgo Biloba, you have to assess if the patient's taking your antidepressant, specifically your SSRI, like fluoxetine. Why? Because a combination of Ginkgo Biloba and your fluoxetine can potentially lead to serotonin toxicity, which is potentially fatal. And when you speak of serotonin toxicity, your patient will have hyperthermia, elevated temperature above 38.5 degrees centigrade, muscle rigidity, diaphoresis, shivering, seizures. Okay? And then your Ginkgo biloba is not indicated for pregnant clients and those with epilepsy. Now, how about clients with diabetes? Remember, before you give or suggest the use of Ginkgo biloba to a client with diabetes mellitus, you have to instruct the client to clarify it with their physician first. Okay? So the most common side effects of Ginkgo biloba will include your nausea and vomiting. Once again, if we talk about Ginkgo biloba, it could potentially worsen bleeding because it thins the blood. So before giving Ginkgo biloba, assess if the patient's taking your aspirin, your heparin, your warfarin, rivaroxaban, or the bigatran. All of these drugs are anticoagulants. Or if the patient's taking Ginkgo biloba and the doctor orders warfarin, clarify the doctor's order before giving it, because a combination of Ginkgo biloba and the drugs that may potentially cause bleeding may lead to a worsened bleeding risk. Okay, so let's move on. Now, join our hundreds of thousands of passers all over the world. Our system is now servicing nurses in more than 30 countries worldwide. And we have here a 60-year-old who recently passed NJN with our program. And she's with all of these passers from our program. Okay, increasing in numbers. Okay, and our third pointers specifically would be on those facts related to your echinacea. This is pronounced as echinacea. Okay, now echinacea has 6 different uses. Primarily, it is an immune system booster. So in essence, it supports the immune system. So it is now actually also used as over-the-counter cold remedy or flu remedy. And then it could also be used in the treatment of migraine headaches, as well as it can potentially decrease your blood sugar level, much like your di huang, okay? Because di huang is also an herbal remedy that decreases the blood sugar levels. So if your patient's taking echinacea or di huang, you might want to monitor the sugar levels of the client. Next important thing is that your echinacea could also be used to treat anxiety as well as to decrease inflammation. But take note that since this supports the immune system, this is not indicated for clients with autoimmune disorders like multiple sclerosis, systemic lupus erythematosus, or rheumatoid arthritis. Now, common side effect with the use of echinacea is the appearance of your rashes. So it's very important to tell the patient that this side effect is expected when a patient's taking echinacea. And you don't give echinacea if your patient is having an autoimmune condition. Now, the second thing or question that we need to ask ourselves if we are preparing for the next generation NCLEX would be, how do we study? You always have to learn how to study with technology. A lot of nurses who are in my class would usually have mistakes that are not related to their inability to remember facts, but rather the mistakes were committed because they don't know how to navigate technology. Here at the Ray Gapuz system, we have our set of learning tools like NCLEX RN Flash available in Amazon. The local title in the Philippines is NCLEX 311. And then we have several programs like I asked one student which part of a review helped you the most, and he says the boot camp, but overall it's the functional concept and the syndromic approach, plus the quick fix and the course shell. So this is actually our course shell that summarizes and organizes all the tools so that you can access it anytime, anywhere. Now, this is being given for free access for all of those who are enrolled in our full bundle of instructional tools, which means it includes the books, it includes the face-to-face bootcamp, it includes our online videos, and of course, our course shell. And the third, you have to have a conducive learning environment that should keep your focus. Okay, so this is our class, and the topmost portion is actually a picture taken of our learners using our NGN simulators in our simulation room. Okay, so may I invite everyone to avail of our next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. Your choice of live face-to-face, live virtual class, on-demand unlimited video recorded lessons, QBank plus 3 books. And of course, the NGN strategies and sample questions of Ray Gapuz, that's me, plus our quick fix session. And the fee starts at $3,499. So once again, this is your mentor, your fact check buddy Ray Gapuz, saying thank you for your opportunity and your time to join me in this teaching and learning session. Until my next video, you have to watch my next video if you want to shut down at 85 on NJN. Take care. Don't forget, Jesus loves you.